I remember looking back and scanning a baby and thinking, my goodness, it cannot get any better than that. Rendered images that you see look like a real baby, as though the baby you're holding in your hand. You need to understand the patient that you're seeing, and you need to engage with your patients so you ensure that you establish an element of trust.
That looks completely normal, and I agree with you, it looks completely normal. That requires years of experience.
As I've watched the change over time, not only just in the technology and the improved resolution, but also the opportunity for mothers to get more involved in understanding the progression of their pregnancy and how they relate to their pregnancy, has been a pleasure to watch that over the years.
The answer is no patient wants to get late diagnosis.